Hello friends, I am Dr. Harbans Lal. As you all know, I am contesting for the post of Vice President AIUS. During the course of conversation with my friends and supporters, I realized many of them are advising and guiding their family and friends due to overstressed healthcare system. My team, comprising of Dr. Ikeda Lal and Dr. Tinku Bali Razdan, will discuss with the experts to bring to you Beat the COVID series of short videos to clear all your doubts and to give you authentic, precise, and brief knowledge.
Hello, respected seniors and my dear friends. I, Dr. Ikeda Lal, welcome you all to this series on Beat the COVID. Today, we are happy to have with us my dear friend and an expert on COVID, Dr. Jumana Hussain. She did her MD Medicine from Kasturba Medical College, Manipal. After her training, she worked at Apollo Institute of Medical Sciences and Research. Currently, she is an assistant professor at Nizam's Institute of Medical Sciences in Hyderabad, where she is an integral part of their COVID managing team. She is on risk of exposure and COVID treatment guidelines committee. A very warm welcome to you, Jumana, and thank you for being with us here today.
Hi, Keda. Thanks for the opportunity.
In today's session, we will be discussing about vaccination. So, as we all know, vaccine is one of the most important and effective strategies in decreasing the sheer numbers with which the people are affected by COVID-19 and also helps in decreasing the severity of the disease. There are a lot of myths surrounding the vaccination, and a lot of people are scared to take the vaccine. So, let's look at all the vaccines available and if are there any contraindications to these vaccines. So first question I think we should address is there a preference? Which vaccine should I take? If I have the option to take Covaxin or Covishield, should we choose one over the other? Is there evidence suggesting the efficacy of one over the other?
So, Keda, now the studies are showing that Covaxin and Covishield are almost equally effective. They're both around 80% efficacious in preventing COVID-19. So, in terms of choosing which one, you should, because of the vaccine shortage, whatever is available to you, I would recommend that you just go ahead and take it. There was a lot of a lot of queries around it initially when both the vaccines came out about who can take it and who can't take it. But as time goes by, almost everyone is eligible. The only reason for you not to take this vaccine would be if you are specifically allergic to any of the ingredients present in either of these vaccines. Otherwise, even an immunocompromised person, and even now they are recommending that pregnant and lactating women should go ahead and take this vaccine. Although it has not been specifically mentioned by the Ministry of Family Health and Welfare, but gynecologists and obstetricians around the country are recommending that pregnant and lactating women also take the vaccine. So they have been shown to be very, very safe. And what has been demonstrated recently is that even if after receiving one dose of either vaccine, be it Covishield or Covaxin, if a person has acquired COVID-19, the severity of the illness is, extremely low. So it is important to bust these myths and to this hesitancy surrounding getting vaccinated should, we really need to address that and rest assured that these vaccines are extremely safe.
So we can, even pregnant and lactating women can take Covaxin or Covishield now, because right now the Indian guidelines don't say that. And I think in US, they are already giving the vaccine to the Pfizer vaccine, I believe, to a lot of pregnant as well as lactating women. So I think
if you go by vaccine, when you talk about vaccine science, the only time a vaccine is contraindicated in a pregnant or lactating woman is when it is a live vaccine. Now, neither of these are live vaccines. So, I can only think of benefits for a pregnant woman or a lactating woman to be taking these vaccines because your baby will get the antibodies, either through the placenta or through the breast milk. So it's only benefits. I don't see anything wrong in giving a vaccine to pregnant and lactating women. I would encourage it.
That's a very important point, I think, and I think we need to change our strategy and soon start giving vaccine to all the adults that we can vaccinate as soon as possible. Another important question that I have is that suppose a person gets the COVID-19 infection, how long do they need to wait before they can take the vaccine? In other words, how long does the infection per se provide some antibodies, and when should they, when can they take the vaccine? Or if they have taken one dose of the vaccine and then they get the infection, how long should they wait to take the second dose of the vaccine?
Yeah, that's a very important question, Nikita, because many people have taken the vaccine and developed COVID-19 after that, and they're like, oh, the vaccine doesn't work because I got COVID even after I took the vaccine. But what they are not recognizing is that they most of the people who have acquired COVID after getting their vaccine have had extremely mild illnesses that could have been managed at home. So, okay. So, when do you take the second dose of your vaccine? Normally, for Covishield, they say 4 to 8 weeks, and for Covaxin, it is about 4 to 6 weeks to take your second dose. But if you have had COVID after your first dose of vaccine, wait 4 to 8 weeks before taking the second dose. Approximately 30 days after complete recovery. So that means after you have come out of isolation. So you wait 30 days or 4 to 8 weeks, some guidelines say, and then go and get your second shot, but make sure that you do get it.
So, is it recommended that once we've had COVID-19, we wait and then we get our antibodies level checked and then take the vaccine? Do we need to do that to see if we have already have antibodies for some time against the infection, reinfection, so to speak?
No, Ekeda, because those antibodies that we are testing, first of all, we don't. Those are antibodies that you have developed as a reaction to getting the COVID infection. But and what we are testing for doesn't mean that those are necessarily the protective antibodies. So those tests have just come into the picture, but they're just confusing things. And I don't think anybody should be trying to test their antibodies and say, yes, I have antibodies, so I'm immune. I think that test can totally be done away with. Just keep in mind that they know when your immunity peaks after taking the vaccine, and after getting COVID when your immunity peaks, and when it drops. So we should follow the guidelines and go according to that. You're trying to do these antibody tests in between, it's just going to confuse you. So I think we can avoid that altogether. Yeah.
Are there any contraindications to vaccine? Suppose a patient is on blood thinner. There's a lot of talk about the reports of coagulation and thrombosis with these vaccines, or if the
Yes.
patient has a prothrombotic state.
Correct.
How would you go about, what is your message to those patients? What should we tell them as doctors, that whether they can go ahead and take the vaccine, or do they need to consult a physician first?
Right. So number one, these reports about developing thrombosis after taking the Covishield vaccine, those reports are very, very, very few. And let me tell you that getting COVID will increase your risk of thrombosis 100-fold more than getting that vaccine would. So definitely, you would rather take the vaccine and take that 1 in a million chance, as it is with any vaccine. You vaccinate your kids, so why the fear for vaccinating yourself?
Right.
So, and getting COVID would be much more dangerous and definitely increase your risk of thrombosis in any case. So you may as well take the vaccine. That is much, much safer. And in terms of when we're talking about people on antiplatelets or anticoagulants, there is no contraindication for them. The only thing is, because it is an intramuscular injection, the fear of a hematoma forming is there. So once you take the injection, do not rub it. Make sure they apply firm pressure, for about 3 to 5 minutes to make sure that the hematoma doesn't form. The only contraindication, I would say, if a person is on oral anticoagulants, so these would be, patients who have prosthetic heart valves and things like that. They are trying to maintain their INR between 2.5 to 3.5. So anything above 3.5, now that becomes pathologic. They don't want their INR to be more than that. But if it happens to be, then they need to talk to their primary physician about it, about correcting the INR to less than 3.5, and only then can they take the vaccine.
Thank you so much for educating us about the different vaccines and contraindications for vaccination. And thank you for clearing up all our doubts. I think we are first doctors and then ophthalmologists. We should promote this vaccination to whoever we come in contact with, whether it is our near and dear ones or our patients. So let's try and motivate more and more people to take the vaccine and stay safe. Thank you, Jumana. Thank you for taking us the time.
Definitely.
Thank you so much.
Most welcome. Thank you, Ikeda.